But of course, what's most important is keeping our medical system in check. Allison Croft joins us now again, and we're watching those numbers every day. But this week, Governor DeSantis, Allison, said he's changing the way that they're tracking ICU beds.
And we know that's important because hospitalizations and ICUs are things that we have to monitor so we can track the severity of the spread of the virus. Remember, we don't want hospitals to get overwhelmed. So what has changed? Let's take a minute. We want to break all of this down for you tonight. This is the system in place. The Florida Department of Health dashboard gives us a tally of hospitalizations. Now, the Florida Agency for Healthcare Administration has an emergency status system, which you see here. This is constantly updated, showing the availability of ICU beds by facility and county. Doctors we've talked to said this is useful because we can track severity. But the governor wants to change how they're tracking ICU beds. Just yesterday, Governor DeSantis' communications director tweeted this: "There is a difference between the number of critical care patients needing an ICU bed as opposed to those occupying an ICU bed for COVID quarantining, which is why Governor DeSantis is ensuring the data accurately reflects that difference." Smart. So we reached out to the governor's office to find out if that system is going to be put out so that we can see the details of the availability of ICU beds and how they're tracking it. We haven't heard back from the governor's office just yet on this. We did hear from a spokesperson at ACA. Hospitals plan and prepare for the surge, although that additional capacity is not reflected on the agency's dashboard. Hospitals have the ability to convert beds and bring additional ICU beds online in a surge situation when necessary. Within 48 hours, hospitals have the capability to dramatically increase statewide staff capacity in the event of a surge situation. Now, experts we've spoken to stress it is important to look at trends. It's why the information and the charts that we show you every night are looking at a 2-week period. Now, if we change how we track data now, we're going to have to wait days for a pattern or a trend, and we can't compare today with where we were in March.